I'm Melissa Ponzio, and this is WebMD's Ask the Pharmacist. With McCary Weck-Marciniak, National Spokesperson for the American Pharmacist Association, Clinical Associate Professor at the UNC Eshelman School of Pharmacy, and practicing pharmacist. She's here to answer the most frequently asked pharmaceutical questions put to us by you, the WebMD community. Today's topic covers questions about things to do and not to do when pregnant. We'll cover taking medications for pain and infection, both prescription and over-the-counter, and more. Let's get started with our first question about taking something for pain. Can Tylenol PM hurt an unborn baby?
This is a great question, especially it's good to know what medications you should or shouldn't take when you are pregnant. So Tylenol is a medication that is safe to take during pregnancy. Tylenol PM includes an antihistamine called diphenhydramine as a part of that pill. And that is also okay to take during pregnancy. But I would say as a general rule, we try to avoid using non-prescription medications if we can while someone's pregnant. We'd rather stick with some non-drug measures. So I would want to ask this mother why she's using the Tylenol PM. Is it to get to sleep? Is it because she does have some pain? Because there may be some better options, non-drug, that would help her and be entirely safe. But certainly Tylenol PM would not hurt her unborn child.
Here's another question from a concerned mom-to-be. Can you take Aleve while pregnant?
Another great question. Now, Aleve is also known by the generic name naproxen, and this comes from a class of medications called NSAIDs, or non-steroidal anti-inflammatory drugs. And people commonly use NSAIDs to treat pain or fever. This class of medications, though, should be avoided entirely while you're pregnant. It could be very harmful, and so this would be a medication I would not recommend any mother to use. A better choice would be to use acetaminophen. That's safe for all trimesters of pregnancy.
Okay, let's take another question. Can I take ibuprofen while I'm pregnant? Is that part of the NSAIDs as well?
Yes, it is. So ibuprofen, which also goes by the brand names Advil or Motrin, is also a member of the class of NSAIDs, those non-steroidal anti-inflammatory drugs. And as such, we should avoid its use entirely during pregnancy. So a better choice for someone might be to use acetaminophen, and that's safe during all trimesters of pregnancy.
Okay. Can a woman who is 22 weeks pregnant use an icy hot patch for lower back pain?
So as a general rule, we do try to use some non-drug measures to treat things while you're pregnant. And certainly back pain is common, particularly as the baby grows. It puts a lot more pressure on the mother. So something that's topical or kind of is applied on the external part of the skin is an okay choice. And an icy hot patch would be an example of that. So it would be okay to use icy hot. Another suggestion I might have would be heat. Perhaps some low-level heat like on a heating pad.
Great. And now we have one about treating a cold. What kind of cold medicine can I take while I'm pregnant?
Well, cold symptoms are sometimes very difficult to deal with, but all colds are self-limiting. They usually go away on their own within 7 to 10 days. So generally for cold, we try to have some mothers stick it out a little bit.
And struggle through it.
And struggle through and try not to use any of the non-prescription medications. But again, we do have some non-drug choices. So depending on her symptoms, if it's something like congestion, we might recommend nasal saline. And that's easy to administer and can be used as often as you need and is entirely safe for the woman. And if some aches or pains are present, acetaminophen or Tylenol would be a great choice. So I'd probably stay towards those options for cough and cold and not use some of the medications like antihistamines or decongestants or cough suppressants that we find over the counter.
What about like a menthol rub?
I think a menthol rub would be another good choice. Again, when women are expecting, we do try to stick with some non-drug options first, or maybe some things that are topical. But I probably would want the person to check with their primary care provider, but I think that could be a good option.
Great. A lot of women experience heartburn while pregnant. This mom-to-be asks, what medications or over-the-counter options are safe during pregnancy for heartburn or acid reflux?
I think it'd be pretty surprising for a woman to get through her whole pregnancy and not have heartburn. So it's definitely one of the complaints we hear most often from our mothers. And so I think the best option in this case would be an antacid because it's easy to use, easy to take, and it helps to get some calcium for your bones as well as treat your antacid symptoms. So that would be probably our prescription of choice, if you will, for someone who's expecting.
Okay. Now we have one from a soon-to-be mom who it sounds like may be trying to quit smoking. Is it safe to wear a nicotine patch while pregnant?
Quitting smoking is definitely something that's very important for someone to do while they're pregnant, but it's really difficult for us to use some medications for that. So we would prefer if the mother would try to do cold turkey, which can sometimes be very difficult. Stress and strain of a pregnancy alone, plus trying to quit smoking, it can be a lot. Now, generally, our nicotine replacement therapies, like a patch, are pregnancy category D, which means that we wouldn't use them for someone who's pregnant. But some practitioners will say that using nicotine replacement therapy might be better than actually smoking. You're removing all of those carcinogens, but you're still getting nicotine. So I would say in this case, if someone's trying to quit smoking while pregnant, it's best to talk with their primary care provider or their OBGYN to just ensure which route they would like to go. If not cold turkey, what they think might be the best option. But according to the label, we would try not to use those in women who are pregnant.
Here's one about treating an infection while pregnant. I'm 8 months pregnant and have a yeast infection. What over-the-counter medication is safe for me and my baby? This is one area where if someone came up to me and asked this question, I would unfortunately not be able to help them out too much over the counter.
Okay. The best scenario in this case is for this person to go talk to their primary care provider or their OBGYN. We definitely get concerned about infections while someone's pregnant, and it's best not to use an over-the-counter medication in this case. They should talk with their primary care provider for a couple of reasons. They may think that they have symptoms of a yeast infection, but it actually could be another type of infection. And so we want to make sure we're accurately diagnosing that infection. And it's, of course, more problematic when they're expecting versus someone who is not. So in this case, I would refer them to use something from their provider, which so that they're aware, and I would not give them something over the counter.
This question concerns taking a prenatal vitamin. My prenatal vitamins make me nauseous. They are too big and they taste bad. Are there any easier to take options available?
Well, certainly this woman is not alone. Prenatal vitamins can be very difficult for some people to take. They're often what we affectionately refer to as horse pills. They're very large and sometimes can make people feel a little sick on their stomach. So if she really cannot tolerate the one she's trying, she may be able to try a different brand. It's possible another one has a different flavor, a scent, something to it that may be more palatable to her. If we've tried an option or two over the counter or prescription and we still haven't found one that works, we may be able to talk with her provider because they may be okay with her taking a multivitamin and some folic acid in addition, usually as two separate kind of tablets. And in that way, she may be getting most of the things she would find in her prenatal vitamin.
Could you try, I've always, been told to take vitamins on a full stomach. So do you want to do that with prenatal vitamins as well? Like maybe if you take it on an empty stomach, you might get sick.
You certainly can. You can certainly try some snacks, maybe a cracker or something light on your stomach. And for some women, the morning sickness is sometimes not only in the morning, but all throughout the day. And unfortunately, sometimes just in general, they're going to be a little bit more sick on their stomach and might have trouble either way. But certainly it can't hurt to try having it with a little bit of food and see if that makes it easier to go down.
Okay. Here's another about prenatal vitamins. What's the difference between prescription and over-the-counter prenatal vitamins?
In general, prescription and over-the-counter prenatal vitamins are fairly similar, but where they probably differ is in their amounts of folic acid. So folic acid in products that are available over-the-counter usually contain about 400 micrograms, whereas products that are available by prescription usually have more like 1,000 micrograms available in it. And they also may differ in their content of iron. There may be more iron available in those prescription products than there are over-the-counter. But both are probably acceptable choices for an individual to take.
Now we have a few questions from women trying to conceive. Can certain medicines cause a false result if using a home pregnancy test?
Yes, there are some medications that can interfere with a home pregnancy test. And really the most common one are fertility medications that someone might be using, like clomiphene. And so in that case, there are some things that could affect that pregnancy or test. And if so, if someone's on those fertility medications, they may just want to check with their OBGYN office. They may come in for a test in the office rather than use one over the counter.
Now we have another question about drug interaction affecting the ability to conceive. My husband and I are trying to have a baby. Are there any medications that will affect my ability to get pregnant?
The one thing a couple should do is if they're ready to conceive, they should make sure that the wife is taking 400 micrograms of folic acid daily. This will ensure that they can prevent against any neural tube defects like spina bifida that could result if they weren't taking enough folic acid.